Hi, this is John Adamson, the rehab documentation guru. This is my third attempt to do this video because doing it right off YouTube and I've been interrupted twice. So I have orders, I've given orders to make sure no disruptions occur. Hopefully, hopefully that works. It can be hard with a family with one wife and 9 children. So anyway, I wanted to talk to you about documenting patient caregiver education. It is a skill and it needs to be documented as such. And so I want to give you 3 things plus some extra information that you want to consider when documenting that. Number 1, you want to document who was trained. And believe it or not, I've seen a lot of notes over the course of 10 years of review where you can't tell who was trained. And that might be a problem if you have a patient, let's say, that's got multiple shifts of caregivers that's taking care of them. Make sure it's clear who you trained. And also, just as a bonus, make sure that if you're doing caregiver training, the patient is evident in the note, meaning that it's clear to the auditor doing the chart review that if you're doing caregiver ed, that the patient had to be there. We had a claim denial once that I had to deal with where it was not clear if the patient had to be there. Otherwise, the documentation was good, but the auditor dinged us and said that the care appeared to be outside the scope of the care plan. And so make sure the patient had to be there. Number 2, make sure that you document what you trained and be specific. It's skill that you're imparting, and a lot of therapists document such dumbed-down caregiver or patient education. It's not clear what was the skill. Let me give you an example. Patient was educated in bridges, doing bridging exercises for core strengthening. Well, you know what? You can look up any YouTube video about various exercises for basic strengthening of the core, and you'll find a bridge and taught by non-therapists. But what makes that skilled? Well, let's say you're teaching this patient who has lumbar spinal stenosis. And when they go into do a bridge, they actually go into hyperlordosis. And then they come back the next day and they tell you, my back is killing me from doing those exercises you gave me. And you watch them do it and you go, oh, well, that's your problem. You're hyperextending your back, which is further causing problems with your lumbar spinal stenosis. So let me teach you how to do what's called a posterior pelvic tilt while you're doing your bridge. That specific documentation will help answer why was it that you as a therapist needed to do the training and not somebody else. Here's another example. You got caregivers that are doing transfers of the patient, but they're doing it wrong. Now, if they're paid caregivers, then they should have some basic education in that area. But maybe they don't have the knowledge and skill of how to handle that patient with hemiplegia who's got absent proprioception and kinesthesia of the right lower extremity, and they've got a visual field neglect towards their right side. Make sure it's clear why you had to do the training and not somebody else. So be specific about your skill. And then number 3, document the return demonstration. Now, one of the things that I see a lot of therapists do is they'll just get into percentages of return demo. So let's say I'm a therapist covering your patient, and your last note says, patient demonstrated 70% return demonstration on transfer techniques. I'm going to look at that note and go, what the heck does that even mean? Like, what am I supposed to pick up on? What's that 30% represent that I still need to train the patient on? So break it down into details, and you might even consider getting away from the whole percentage thing and just talking about, okay, the patient has X, Y, Z, but they still need to do A, B, C. And be specific. That way it's clear whether you're treating the patient or not, what's left over. So there you have it, the 3-part formula: who was trained, what was trained, and return demonstration. But here's something else to think about. Medicare does not pay for repetitive training. And a lot of the CPT codes that deal with training related issues expect patients and or caregivers with normal cognition, so they have no documented cognitive deficits, to learn things within 1 to 3 visits generally, depending on the complexity of what you're training them. So think about that. 1 to 3 visits, that's not very much. So make sure it's clear you're training the right person. And folks, if you're training a patient in something and they're not getting it within a week, are you training the right person? Because possibly they're not going to pick up on it. Now we know that patients with cognitive deficits might need more prompting, more education over time. But one of the things that Medicare is clearly not paying for, and they say it in their regs, is repetitive training. So think about this. If you have a patient who's being supervised by somebody else already, a caregiver, and the patient has cognitive deficits and they need to be trained and the training's repetitive, why not just train the caregiver to do the repeated type of training so that you can be done in 1 to 3 visits, and then that caregiver can repeat that training with the patient who will eventually get the information with enough repetition. So you got to think through those things when you're doing patient and or caregiver ed. And so many therapists make the mistake of repetitive training to the wrong person. And usually, of course, that's the patient. So anyway, this is the Rehab Documentation Guru. If you liked this content, please hit the like and subscribe. Also, I do speak for 2 companies. One is called Allied Health Education, and I teach 2 courses for them. One called Neuromuscular Reeducation, which takes you through from start to finish what you should document for neuromuscular reed. One is called Documentation Essentials. It's a 2-hour basics on how to document. And then I teach a 6-hour course for another company called Summit Professional Education called Documentation Boot Camp. And so anyway, I appreciate you watching this video. Hope you have a great day. Take care for now.